Hey everyone, it's your name here. Today, we're diving into a crucial topic that could save your life or the life of someone you love. Let's talk about the 5 pre-heart attack symptoms you should never ignore. We're going to break down each symptom, discuss what it feels like, and most importantly, what you need to do if you or someone around you experiences them. Remember, knowledge is power, and understanding these symptoms could make all the difference. The most common sign of a heart attack is chest discomfort. This discomfort can manifest in various ways, and it's crucial to recognize the different forms it can take. But here's the thing. It doesn't always present as the dramatic, Hollywood-style chest grab you might imagine. In reality, the symptoms can be much more subtle and varied. It can feel like a pressure, a squeezing, a fullness, or even just a dull ache right in the center of your chest. This sensation might be mild at first, making it easy to overlook or dismiss. Imagine an elephant sitting on your chest. That's the classic analogy, but sometimes it's much subtler. You might feel a tight band around your chest or a heavy weight pressing down. Now, this discomfort might last for a few minutes, or it might come and go in waves. It's important to pay attention to these patterns as they can provide crucial clues about your heart health. Don't dismiss it as heartburn or indigestion, especially if you've never experienced it before or if it feels different than usual. Heartburn typically feels like a burning sensation, while heart-related discomfort can be more of a pressure or tightness. If you're having any kind of unusual chest discomfort, even if you're not sure it's your heart, it's always better to err on the side of caution. Seeking medical advice promptly can make a significant difference in outcomes. If the discomfort is severe, persistent, or accompanied by other symptoms like shortness of breath, sweating, nausea, or lightheadedness, don't hesitate to call emergency services. Time is of the essence in such situations. Remember, heart attacks can happen to anyone, regardless of age or fitness level. Being aware of the signs and acting quickly can save lives. Educate yourself and your loved ones about the symptoms of heart attacks. Knowledge is power, and being prepared can make all the difference in an emergency. Consider taking a first aid or CPR class. Knowing how to respond in an emergency can be invaluable, not just for heart attacks, but for a range of medical situations. Maintaining a healthy lifestyle can also reduce your risk of heart disease. Regular exercise, a balanced diet, and avoiding smoking are key factors in keeping your heart healthy. Regular checkups with your healthcare provider can help catch potential issues early. Monitoring your blood pressure, cholesterol levels, and other vital signs is essential for heart health. Stress management is another important aspect. Practices like meditation, yoga, and deep breathing can help reduce stress and improve overall heart health. Lastly, don't underestimate the power of social connections. Spending time with loved ones and maintaining a strong support network can have positive effects on your heart health. Taking these steps can help you stay heart healthy and recognize the signs of trouble early. Remember, your heart health is in your hands. Stay informed, stay prepared, and take action when needed. The next symptom we're going to talk about is shortness of breath. This is a common issue that many people experience, but it's often overlooked or dismissed as something minor. However, it can be a sign of a more serious underlying condition that needs immediate attention. This can happen with or without chest discomfort, and it can be quite alarming when it occurs unexpectedly. You might be sitting down, relaxing, and suddenly find yourself struggling to breathe. And it can be a real red flag. Shortness of breath is not something to take lightly. It can indicate problems with your heart, lungs, or even other parts of your body. You might feel like you simply can't catch your breath, as if there's not enough air in the room. This sensation can be terrifying and can cause a lot of anxiety, like you're gasping for air even when you're not exerting yourself. Imagine feeling out of breath while just sitting or lying down. This is not normal and should be addressed by a healthcare professional. Maybe you're breathing harder than usual, even after just a little bit of activity. Simple tasks like walking to the mailbox or climbing a few stairs can leave you feeling winded and exhausted. Think about it. Your heart and lungs work together. They are a team, constantly supplying your body with the oxygen it needs to function properly. Your heart pumps oxygen-rich blood to your body, ensuring that every cell gets the oxygen it needs to produce energy and keep you going. And your lungs take in oxygen and expel carbon dioxide. This exchange is crucial for maintaining the balance of gases in your blood and keeping your body in optimal condition. If your heart isn't pumping efficiently, your lungs can't get the oxygen they need, leading to a buildup of carbon dioxide and a lack of oxygen in your blood. And you start feeling short of breath. This can be a sign of heart failure, lung disease, or other serious conditions that require medical intervention. This is why it's so important to pay attention to any sudden or unexplained shortness of breath. Don't ignore it or brush it off as something minor. Seek medical advice to determine the cause and get the appropriate treatment. Your health and well-being depend on it. Remember, early detection and treatment can make a significant difference. If you experience shortness of breath, especially if it's sudden or severe, don't hesitate to contact your healthcare provider. They can perform tests to determine the cause and recommend the best course of action. Treatment may involve medications, lifestyle changes, or other interventions to improve your heart and lung function. By addressing the issue early, you can prevent more serious complications and improve your quality of life. In some cases, simple breathing exercises and physical therapy can help improve your symptoms and make it easier to breathe. Your healthcare provider can guide you through these exercises and monitor your progress. Don't let shortness of breath control your life. Take action, seek help, and breathe easier knowing that you're taking steps to protect your health. Now, you might be surprised to learn that nausea and lightheadedness can also be signs of a heart attack. While these symptoms are often associated with less severe conditions, such as a stomach bug or dehydration, they can sometimes indicate something much more serious. Understanding the potential severity of these symptoms is crucial for your health and well-being. You might feel sick to your stomach, like you're going to vomit. This sensation can be quite unsettling and is often mistaken for a simple gastrointestinal issue. However, when this nausea is accompanied by other symptoms, it could be a red flag for a heart attack. It's important to pay attention to your body and recognize when something feels off. You might feel dizzy, lightheaded, or even faint. These sensations can be disorienting and may cause you to lose your balance or feel unsteady on your feet. Dizziness and lightheadedness are often overlooked as minor inconveniences, but they can be indicative of a more serious underlying issue, especially when they occur suddenly and without an obvious cause. Some people even break out in a cold sweat. This type of sweating is different from the kind you experience after exercise or in hot weather. It's often described as clammy and can be a sign that your body is under significant stress. Cold sweats can be a response to pain or a signal that your heart is struggling to pump blood effectively. These symptoms can be easy to dismiss, especially if you don't have any other obvious signs of a heart attack. Many people continue with their daily activities, attributing their discomfort to less serious causes. This can be a dangerous mistake, as delaying medical attention can lead to more severe health complications. You might think you have a stomach bug or that you're just dehydrated. It's common to reach for simple remedies like drinking water or taking over-the-counter medications. While these actions might provide temporary relief, they won't address the underlying issue if your symptoms are related to your heart. But if you're experiencing any of these symptoms, especially in combination with chest discomfort or shortness of breath, it's crucial to seek medical attention immediately. Don't wait to see if the symptoms will go away on their own. Early intervention can be life-saving. If you suspect that you or someone else might be having a heart attack, call emergency services right away. It's always better to be safe and get checked by a healthcare professional. Remember, your health is your most valuable asset, and taking these symptoms seriously can make all the difference. When we think of heart attacks, we often think of pain in the chest. But did you know that the pain can radiate to other areas of the body? This is called referred pain, and it happens because the nerves that supply your heart also supply other parts of your body. You might feel pain or discomfort in one or both arms, typically the left arm, but it can be either. The pain can also radiate to your back, neck, jaw, or even your stomach. It might feel like a tight band around your chest, a crushing sensation, or even a burning feeling. The final pre-heart attack symptom we're going to discuss is unusual fatigue. This is a tricky one because it's so general. We all feel tired from time to time, right? But we're talking about a different kind of tiredness here. This is a fatigue that's out of the ordinary for you, a fatigue that comes on suddenly or that doesn't seem to go away with rest. You might feel completely drained of energy, even after a good night's sleep. You might have trouble concentrating or completing everyday tasks. If you or someone you know is experiencing any of these symptoms, don't wait. Seek medical attention immediately. Remember, it's better to be safe than sorry. Time is of the essence when it comes to heart attacks, and early intervention can be life-saving. Don't hesitate to call emergency services if you think you or someone around you is having a heart attack. And remember, even if you're not sure, it's always better to get checked out. Your health is your most valuable asset, so please take care of yourselves. Thanks for watching, and stay healthy.